Okay, this is your 10-second warning. Everyone please take seats. We will now hear testimony from our second panel of witnesses. And with that, I would note that Professor John Garvey is president of Catholic University of America, and because we've run quite late, we will be taking his testimony. Then if there are any specific questions for Mr. Garvey, we will take them out of order. Then Mr. Garvey will remain as long as he can as the other panel go through their testimony. This is an accommodation that I hope you all understand. And our second witness will be introduced by the gentleman from North Carolina.
Thank you, Mr. Chairman. Dr. William Thierfelder is president of Belmont Abbey. He's the 20th president of my alma mater, having served in that capacity since 2004. He's a licensed psychologist, had a distinguished career, not only as an NCAA Division I athlete, but an Olympian. He and his children live in the suburbs of Charlotte and Gastonia, my hometown. And most importantly, he is the husband to Mary. And so very proud that he is here today, and thank you for the work that you've taken on at Belmont Abbey.
There is an advantage to having a detailed introduction. With that, we recognize also Dr. Oliver, who is president of East Texas Baptist University. I'm sure there will be other alumni there. Dr. Garrett is senior vice president of the academic affairs at Oklahoma Christian University, previously mentioned. And Dr. Laura Champion is medical director of the Calvin College Health Services. And is Barry Lynn here? Barry Lynn was invited by the committee, apparently is not here. Would you please remove the name? And with that, pursuant to the rules of the committee, we will swear in our second panel. Would you please rise and take the oath and raise your right hands? Do you solemnly swear that the testimony you're about to give, swear or affirm, the testimony you're about to give will be the truth and the whole truth and nothing but the truth? Let the record indicate all witnesses answered in the affirmative. Please take seats. And as previously announced, Mr. Garvey, you're up first.
Thank you very much, Mr. Chairman, and thanks to the committee for inviting me to speak here today. I'm the president of the Catholic University of America. Let me say a couple of words about the January 20th final regulation that the Department of Health and Human Services has promulgated, and then a word or two about the February 10th revision. On January 20th, HHS announced a rule that requires most health insurance plans to cover with no copay sterilization procedures and prescription contraceptives, including pills that act after fertilization to induce abortions. The rule includes a fairly narrow exemption. It doesn't cover colleges and universities like my own. It doesn't cover religiously affiliated hospitals and healthcare systems or religious social service organizations like Catholic Charities. Consider the effect that this rule has on the Catholic University of America, my institution. We teach our students in our classes that marriage is a sacrament in which spouses share in the creative work of God. We teach that it's wrong for couples to close themselves off to the possibility of life. We teach that abortion is a grave wrong, and we reinforce these messages in the work of student life and in campus ministry, in our student organizations, and in the daily interactions of faculty and staff with students. The rule forces the university to violate its convictions in two ways. First, it requires the university to pay for drugs and procedures that we view as morally wrong. A few minutes ago, the Congressman from Illinois referred to a provision in Jefferson's Bill for Religious Liberty. Let me quote again what Jefferson said. Jefferson said that it was sinful and tyrannical to compel a man to pay for the propagation of opinions which he disbelieves. How much more evil to compel financial support for putting those opinions into practice. The regulations order Catholic University to become the provider of contraceptives, sterilizations, and abortions for its students, faculty, and staff. Second, the rule forces us to deny in one part of our operation what we affirm in another. We teach our students in our classes, in our sacraments, and in the activities of student life that sterilization and contraception and abortion are wrong. The rule requires our staff to offer these very services to our students as part of our health insurance program. It makes hypocrites of us in our moral teaching. In response to widespread criticism of the rule, the President last week announced a scheme that was designed to allay concerns about religious freedom while still providing the same services to all women affected by the final rule. The proposed solution is this. When religious institutions like Catholic University object to including mandated services in their health plans, our insurance company will provide them. It's hard to see how this revision changes the picture. Greg Mankiw, an economics professor at Harvard University, makes this observation. Ultimately, he said, all insurance costs are passed on to the purchaser. So I cannot see how the February 10th revision is different in any way from the final rule other than using slightly different words to describe it. In both cases, the Federal Government orders us to buy an insurance policy. In both cases, the policy must cover mandated services. In both cases, we pay the bill. The only real change is that the insurance company, rather than the university, notifies subscribers that we cover contraceptives. The Administration suggests that there is a difference because insurance companies will discover that their costs actually go down. Wider contraceptive use will mean fewer pregnancies and lower indirect costs like productivity losses. If there are no added costs, the implication is Catholic University won't really have to pay for the mandated services. We might call this the Shazam Theory. It resolves the intrusion on religious liberty by making the compelled contributions magically disappear. But there are two problems with the theory. One, I suspect that the proposed cost savings are imaginary and not real. We do know that mandated services have a cost. Senators Shaheen and Murray and Boxer have estimated the cost of contraceptives alone at $600 per woman per year. These costs will certainly be included in the price of our insurance policy. Insurance companies haven't hesitated in the past to cover the cost of things like gym memberships that actually do save money. They haven't done this yet with contraceptives. Maybe they haven't yet discovered the hidden savings in the Administration's Shazam Theory. But I worry that this is a case where politicians have made a bet that they can outwit the private market, and the stakes they're playing with are our religious freedom. I said there were two problems, and the second one is this. From a moral point of view, the cost savings don't really matter even if they are real. Suppose, just to take an extreme and imaginary example, the Administration believed we could reduce overall health care costs by covering infanticide by young mothers who found their children a burden. And suppose that HHS devised a plan under which the necessary drugs would be charged to Catholic University's account. Would we have no moral objection to that plan if the government could show that it saved us money? The point is that we shouldn't be forced to pay for activities and processes that we think are immoral. I think a more likely explanation for the rule is that HHS is acting on a political agenda about how women should live their sex lives. The February 10th announcement discloses this agenda in fairly plain terms. Here's what it says. A broader exemption, the announcement states, would lead to more employees having to pay out of pocket for contraceptive services, thus making it less likely that they would use contraceptives, which would undermine the benefits described above. HHS might wish to increase the rate of abortions and sterilizations and contraceptive use by students and employees at the Catholic University of America. It has shown a desire to conscript the university and its insurer in the service of that agenda. But it's our religious belief that these activities are wrong, and we think that a decent respect for the principle of religious liberty should leave us free to act on our belief. Thank you.
Thank you. And as promised, I'll recognize myself, and I'm only going to take 1 minute. Just to review, if you save money by some procedure that you find morally wrong within the teaching of your church, you still wouldn't do it.
We certainly wouldn't.
And if the government determines there's money savings by this procedure, you, in fact, shouldn't be forced to do it on behalf of saving the government money.
The Catholic Church is not alone in teaching and believing that it's wrong to do an immoral act in order to save money or achieve some other desirable end.
And the previous panel said, basically, Caesar can do it if Caesar wants to, just don't have us do it for Caesar. So let me just ask the question. Since Planned Parenthood receives huge amounts of money, contraceptions are given out at federal and state level at no cost to people regularly, hasn't government already, under the Secretary's auspices, determined that they're giving out contraceptions? I'm not going to talk about all the procedures, but contraceptions. They already give it out at government expense to people who apply for it in most, if not all, areas. So in other words, the Secretary's $600 saves money. She's already doing that with government money, isn't she?
The controversy that we're discussing today is sometimes presented as a conflict or a contest or a dispute or a weighing of the rights of religious liberty on the one hand and the rights of reproductive freedom on the other hand.
Yeah, but I was limiting.
I want to emphasize that our objection, we're not here objecting to the fact that, women who attend Catholic University are still free and able to purchase contraceptives and these other services. The fight is about whether we should have to pay for it.
Well, exactly. But you already pay for it through your taxes. We all pay for it through our taxes if government gives it away. The fact is that government's already doing something that this rule is telling you to do, even though it's objectionable to your basic tenets of faith. Is that right?
I think so.
Thank you. Anyone else have questions for our first witness? He's going to remain as long as he can. Go ahead, Mr. Cummings.
Just one question. President Garvey, is your objective to the payment or the fact that an employee or students are receiving these services at all? Or both?
We're here today because we object to the second, not the first. There are other ways of solving this problem, and we might very well object to them. For example, here's a solution that doesn't interfere with our religious liberty. The government itself could provide these services to young people and to employees at no cost to either us or the employees or our insurer. We would object to that as well because we believe as a Catholic university that it's part of our concern to attend to the moral formation of our students. But that's not an objection about our religious liberty.
Okay. All right. I just wanted to enter into the record, Mr. Chairman, a list of Catholic schools in 20 different states that currently offer some form of health insurance coverage for contraceptives.
Without objection. Quigley, you had a quick question?
Sure. In the previous panel, Doctor, the question was, there's also legislation that we're discussing, introduced into the Senate, that would take this exemption to all private sector employees as well. Do you support that? I mean, do you believe that the private if an employer of a large corporation, the owner of a large corporation or a small one, has the same moral objections that you do you think that we should be able to force them to provide contraception?
First of all, Congressman, I appreciate the promotion. I'm not a real doctor.
I'm sorry. I can't see I can't see the signs from here. I apologize.
Would I take the same position with respect to private institutions or private employers' religious objections? Yes, I would. That would leave us in no worse position than we are before the passage of the regulation. And I think that private individuals, and not just churches and religious institutions, have rights of religious freedom.
So the question comes: how far do you take that to those other people's? I mean, we represent people of all faiths. Many disagree with this, and they believe that contraception is perfectly okay. At what point do you lose control over them? That besides perhaps an assistant professor's wife that is employed, what part of the bargain is there for all manners of university toward this end. Never mind in the private sector. How far do you go with your beliefs influencing millions of other women?
That's a really important question, Congressman, and let me suggest that this body has provided the perfect answer to that question. When you passed the Religious Freedom Restoration Act, you said that rights to religious freedom should not be indefeasible, that there are some occasions when they have to yield, but what the government has to show in order to defeat a claim of religious liberty is that the government has a compelling interest in doing what it's doing, and that they're employing the least restrictive alternative to interfere with religious freedom. And the Religious Freedom Restoration Act that I'm referring to applies to private employers no less than religious institutions.
But in the end, someone has to make that choice.
Yes, they do. Congress has made this choice for us.
And I understand, but we make these choices all the time, and some of them are difficult. I mean, some of them are obvious. I have the example of this Louisiana justice who refused to marry interracial couples because, as he said, I found out I can't be a justice of the peace and have a conscience. That was his belief, his heartfelt religious belief, however horribly misguided. We said today a minority even of one matters, and we can't trample their religious beliefs. You know, where do we draw the line with someone like this? Where do we draw the line with others whose faith is just as important to them? Christian Scientists and others who don't believe, other groups that don't believe in transfusions. You know, if they have a health care clinic or a hospital or other faiths do, it just seems so out of sync for us to imagine that that would be okay. But if you follow the same stream of thought, there's really not that much difference from what you're professing today, projecting your faith, which I deeply appreciate and respect, on others. Millions of women who have, I think, some right to make those choices that don't actually work in the church.
Let me just say one more time, Congressman, that we're not trying to impose our beliefs on our employees or our students. The question that we're discussing is whether the university should have to pay for activities that it views as immoral.
Thank you. And it's going to be a full 5 minutes for members later. Do you have something briefly? Please go ahead. The gentleman is recognized.
I thank the Chairman. I actually have just a couple brief questions. Mr. Garvey, what's the name of the institution where you serve as president?
The Catholic University of America.
And what church are you affiliated with?
The Catholic Church.
Okay. And when employees seek employment from your institution, are they aware that you're affiliated with the Catholic Church?
Yes, they are. As part of the hiring process in the first place, before somebody is hired, we have a discussion about the mission of the university. As part of the intake of new employees in the Human Resources Department, we give them a statement of the university's mission, and they need to check off that they've received it and actually support the mission of the university.
And you adhere to the tenets of the Catholic Church?
Yes.
Okay. So my point here, Mr. Chairman, is a very simple one, that individuals seeking employment from the Catholic University of America go in understanding the tenets of the Church, and therefore the adherence that the institution must follow, and the tenets that the institution must follow. And so if they don't like that, if they choose to go somewhere else, regardless of their faith, they have that free will to do that. And so with that, I yield back.
I thank the gentleman. I would gather that the rules of the Catholic Church are not new or unknown to others, and I think you said that very well. With that, we'll continue on with our witnesses. Doctor? Yeah, you get the microphone.
Thank you. Sorry about that. Chairman Issa, Ranking Member Cummings, members of the committee, my name is Dr. Bill Thierfelder. I'm the president of Belmont Abbey College, and I greatly appreciate you taking the time to listen to my really grave concerns about this health and human service mandate. Maybe to better understand who we are and why this issue of religious liberty is so important to us, let me just begin with the first sentence of our vision statement, which says, Belmont Abbey College finds its center in Jesus Christ. Our mission is to educate students in the liberal arts and sciences so that in all things God may be glorified. In this endeavor, we're guided by the Catholic intellectual tradition and the Benedictine spirit of prayer and learning. Emphasizing Benedictine hospitality, we welcome a diverse body of students, and we provide them with an education that will enable them to lead lives of integrity, to succeed professionally, to become responsible citizens, and to be a blessing to themselves and others. Our Benedictine tradition, which is guided by the rule of St. Benedict, which is really a scripturally based guide for how to live in community with one another, Chapter 53 of that guide is on the welcoming of guests. We welcome each guest in persona Christi, as Christ. And we do that regardless of someone's faith or background. We say, come on in, we love you. That's who we are. If you've never seen our campus, I first of all would invite you all to come. And I'd love to have you over and have a cup of coffee and get to know you better. But if you've been to our campus, it's beautiful. You will see the red brick, Gothic structured buildings that are there. And when those monks first arrived there almost 136 years ago, there was nothing on that property but 2 shacks with holes in the roofs. Those monks literally dug up the red clay, formed them into bricks, dried them in the sun, and placed those bricks there over 130 years ago. So this integration of our faith and the mission of the college is even more visible when you just see the buildings, the layout of the campus itself. When you drive up the main drive, we have a basilica, which is our church. By the way, some of the funding for that came from St. Catherine Drexel. That church is actually connected to the monastery, where we have the monks that live at Belmont Abbey. Connected to the monastery is actually the main administration building where my office is. So to demonstrate here that our integration, the sense of who we are as Catholic and our mission as a college can't be separated. It's essential to who we are. And now our struggle for religious liberty really began in earnest about 4 years ago when we were investigated for discrimination by the EOC because we did not provide abortion, voluntary sterilization, and contraceptives in our health care plan. When the mandate was announced, we had a heightened sensitivity to this issue because we viewed it as really another tactic, in this case maybe an extreme tactic, to coerce us into providing services that we find morally objectionable. Abbot Placid Solari is the head of the monastic community. He is also the chancellor of Belmont Abbey College. He and I meet regularly. We speak all the time about matters of the college. And so when this came up, we obviously discussed the mandate when it first came out in August. And really at his urging and leadership, we both agreed that the best course was to take a defensive action by filing a lawsuit against the federal government, which was no small thing for a little place like Belmont Abbey College to do. But we thought that was what we needed to do at that time based on our experience. We presented the idea to the Board of Trustees, who unanimously approved the action, and with the help of the Beckett Fund for Religious Liberty, we filed a lawsuit against the Department of Health and Human Services. The response by Kathleen Sebelius was somewhat bewildering to us. We could not figure out what a year extension had to do with the issue that we were faced with. Basically, no amount of time would make the morally objectionable mandate somehow acceptable to us. Then, most recently, the President held a press conference to offer what I believe was a fatally flawed compromise. The reason I say this is that the President does not have the right or the authority to take away someone's religious freedom. And therefore, when talking about or offering a compromise, I don't understand how he can give back something that he had no right to take in the first place. So in this particular case, we specifically do object to being coerced into providing contraception, sterilization, and abortion-inducing drugs into our health care plan. But make no mistake, as important as those are to us, the underlying principle here is about our religious liberty. I believe you will discover that there are tens of millions, if not more, of Americans of all backgrounds and all faiths who are thinking just like we are. And I believe that they will not budge an inch on this issue. I think there can be no compromise when it comes to our right to religious freedom and right to conscience. And so I'm here today to ask for your help. This is an issue worth dying for, and many have. Many have made the ultimate sacrifice in order to preserve this right. So please ensure that every American's right of conscience and religious freedom is fully protected. Thank you for considering my plea, and God bless you and all your good work.
Thank you. Dr. Oliver.
Good afternoon, Chairman Issa and Ranking Member Cummings. I appreciate your invitation to share my concerns about this serious threat to religious liberty. My name is Dub Oliver, and I serve as the president of East Texas Baptist University, a Christ-centered university founded in 1912. I would like to raise 4 main points during my testimony today. First, East Texas Baptist University has a religious objection to this mandate, and this mandate violates our constitutional rights. Baptists in America, by virtue of our history, are particularly sensitive to coercive government actions that infringe upon our religious liberty. America's first Baptist leader, Roger Williams, had to flee Massachusetts and found a colony in Providence, Rhode Island, because his religious beliefs were not tolerated. But it's not just about us. Baptists are alarmed whenever any religious group's rights are threatened. As the famous Baptist preacher George W. Truett once said, a Baptist would rise at midnight to plead for absolute religious liberty for his Catholic neighbor, for his Jewish neighbor, and for everybody else. I would be testifying here even if this mandate only affected my Catholic neighbors, but I must point out that this is not just a Catholic issue. While many Christians do not share the Catholic beliefs against contraception, there is wide agreement that abortion is wrong, and we believe, based on the Bible, that life begins at conception. The administration's mandate covers emergency contraceptives such as Plan B and Ella, which even this administration admits interfere with a human embryo. Our faith and the most recent science tells us that these drugs cause abortions. But under the administration's mandate, my university will be required to buy insurance so that our employees can obtain these drugs for free, as if there is no difference from these drugs and penicillin. We believe that is wrong. Second, we are offended that this administration says that we aren't religious enough to have our religious beliefs respected. Last Friday, the administration gave final approval to a rule that includes the narrowest definition of a religious organization ever to appear in federal law. ETBU does not qualify because we teach and serve non-Christians. We accept students of all faiths and students of no faith. The President has now promised that he will someday propose another regulation that will protect groups that the government says aren't religious enough for an exemption, but are religious enough for some accommodation. Why is the government creating different classes of religious groups and assigning each group different rights? That is not the government's job. The First Amendment is designed precisely to stop the government from this sort of picking and choosing. Third, this is not about women's health. This is about whether the government can get away with the trampling on the rights of religious organizations. It is ridiculous to claim that organizations like mine don't care about women's health. As far as I'm aware, no religious group objects to most of the preventative services in the mandate. In fact, we already cover preventative services, including contraceptives, under our employee health plan. We simply object to a few drugs, which the government calls contraceptives, because we believe they cause abortions. Additionally, I've heard it suggested that this mandate is necessary to increase access to contraception. The President said last Friday that close to 99% of women use contraception. I don't know if that number is true, but surely if the President is quoting this number, he knows there is no problem with access. The issue is not about women's health. It's about religious liberty. It's about whether government will force religious people and organizations to do something they believe is wrong. Everyone here wants women to have access to quality health care. What we are asking is that our religious views be respected. To close, perhaps the most frightening aspect of this entire episode for ETBU is that we have no idea where this road will end. Today, the administration is trying to force us to provide our employees with abortion-causing drugs. What's next? If the government can force Catholic monks to dispense birth control, what can't the government do? If the government can decide that ETBU is not religious enough to have the right to religious liberty, what can't the government do? If this administration can just decide that religious beliefs are less important than its chosen policy goals, what can't it do? These questions are alarming, and that is why people all across the spectrum are joining together out of concern that this mandate threatens to erode one of our most precious rights, our religious liberty, guaranteed to us by the First Amendment. I urge this committee and Congress to ensure religious liberty for those of us at East Texas Baptist University and for all Americans.
I thank you. Dr. Garrett.
Chairman Issa and members of the committee, my name is Allison Garrett, and I'm the Senior Vice President for Academic Affairs at Oklahoma Christian University. I'm here today because of my support for religious liberty. I believe in the rights of institutions like Oklahoma Christian to decline to include in their health care plan items or services that are contrary to their religious convictions. Oklahoma Christian University is affiliated with the Churches of Christ. As a university affiliated with this group of Protestant churches, we believe strongly in our right to practice our faith without interference from the government. While we believe that every person is to be in subjection to the governing authorities, we respectfully ask that you not force Oklahoma Christian to choose between following our sincerely held religious beliefs or violating federal law. We oppose the administration's employer mandate requiring that all health insurance plans cover abortion-causing drugs for 4 reasons. First, covering abortion-causing drugs is objectionable to many employers and plan participants. We have no concerns about allowing our plan to cover contraception. Rather, our concerns deal with the coverage of abortion-inducing drugs. The government should not force institutions like Oklahoma Christian to offer a health plan that covers abortifacients like Plan B and Ella. While our views differ from those of our Catholic friends regarding what our plan should cover, our views are exactly the same on whether the government should be able to require individuals or institutions to violate their religious beliefs. The answer to that is no. Second, the exemption is too narrow. As drafted, the exemption applies only to churches, synagogues, and mosques. It is clear that it would not apply to religious institutions like Oklahoma Christian University and hundreds of similar religious colleges, universities, and other organizations. The exemption requires that an organization have the inculcation of religious values as its purpose. We teach our students not just to be proficient as engineers or historians or writers, but to approach their disciplines from a Christian worldview. This is one of the reasons that I chose to leave a corporate career to work in Christian higher education. We incorporate our faith in everything we do at Oklahoma Christian, from daily chapel to prayer before intramural athletic events to service activities around the world. Yet the exemption does not apply to us. The exemption's language is also too narrow because it applies only to the group health plan offered by a religious institution to its employees. Universities typically offer a plan to students as well. And the student plan is offered as a service to students who are no longer covered by their parents' health insurance plans. Third, reasonable alternatives to the employer mandate exist. Nothing about the administration's rule takes away women's rights to obtain contraceptives or abortifacients. This debate is not about whether women have the right to obtain these drugs. Rather, this debate is about whether those who believe that contraceptives or abortion-inducing drugs that violate their convictions must be paid for by them. There is a vast difference between the right to make a purchase for oneself and requiring someone else to pay for it. Fourth, the President's announcement does not present a workable solution. The assurance of the administration that it would work with religious organizations that sponsor self-funded plans in the coming days to reach a compromise is too little assurance on too great a matter. The President's announcement does nothing to alleviate the concerns of institutions sponsoring self-funded plans. In addition, the employer must still communicate with the insurance company regarding who is covered, applicable dates of coverage, and similar matters. In other words, the employer's involvement in arranging coverage of objectionable drugs is inescapable. Forcing employers to cooperate in offering drugs or services that they believe are morally wrong leaves these employers in the same moral quagmire as the original regulations. We ask that the administration and the Congress overturn these regulations because they infringe on our religious liberty. Thank you.
Thank you, Dr. Champion.
Members of this committee, thank you for the microphone. I appreciate your invitation to share my concerns about the contraceptive mandate. My name is Dr. Laura Champion, and I am the medical director and a practicing physician for health services at Calvin College, a private 4-year Christian college in Grand Rapids, Michigan. I graduated from the University of Washington School of Medicine in '96, and I'm board certified in family medicine. Today, I want to share my concerns with you as a person who has the responsibility to negotiate providing student insurance coverage and caring for students clinically. We are an institution whose religious character and mission is central to everything we are and everything we do. In order to understand our religious objection, you need to understand that we take seriously our faith commitments, including our holistic student health services. Since 1876, the Christian Liberal Arts College in Michigan, this Christian Liberal Arts College in Michigan has built a sterling reputation for academic excellence. Consistently ranked in the U.S. News and World Report as a top liberal arts college, it is one of only 4 colleges in the nation to receive a Senior Paul Simon Award for Campus Internationalization. Calvin is fortunate to have a fully staffed health services department to serve the medical needs of our student body. We require that each student have health insurance to attend our school. We offer an affordable option for those students who enroll underinsured. Great care is taken in crafting the student health plan to ensure that it reflects the values and beliefs of Calvin College and the Christian Reformed Church. This student health plan covers all preventative care at 100% according to the medical definition of preventative care. We do not cover Ella or Plan B. In health services, our health services clinicians write prescriptions that include female hormone contraception for varying reasons, including the prevention of pregnancy. However, abortion-causing drugs are not prescribed, nor are they covered in our health plan. These agents are profoundly inconsistent with the belief system of our college and our religion. Requiring coverage of abortion-causing drugs is a direct violation to the spiritual and behavioral standards that Calvin College expects of ourselves and our students. It forces Calvin College to add these drugs to the formulary for our students, and it would violate our religious liberty. To teach one set of values and beliefs and then provide abortion-causing agents for students would lack integrity. We challenge our students to live out the values they believe. Our intent and purpose is that our entire faculty, staff, and students are living examples of believers trying to follow in the footsteps of Jesus Christ. We must ensure that our practices follow our belief. Now, even when Americans hold vastly different views in the sanctity of life, this mandate raises a point that should be examined by all. Does this country value religious freedom or not? Further, the mandate elevates contraception and abortive drugs to the level of preventative health care. They are not. Plan B and Ella should not be considered equivalent to cancer screening or vaccinations. Pregnancy is not a disease. This is a premise that I reject both religiously and medically. The recent White House accommodation purports that the President has the legal authority to recognize or deny religious liberty. As Christians, however, we believe that these rights come from God. And as U.S. citizens, we believe our Constitution affirms and guarantees religious liberty. There is a limit to what the government can do to compel us or not to do. In the particular matters of faith and conscience, it is in the best interests of all Americans of every ideological stripe that this limit, this line, not be crossed. This is not about politics. This is not about contraception. This is not about depriving women of health care. Rather, this is personal. This is about my daily life as a physician, a Christian, and as the medical director. Will I be able to practice medicine within my belief? Will Calvin College be able to continue its historic tradition of living out faith as it teaches? The government that is of the people, by the people and for the people, should not force people to violate their conscience. Thank you, Chairman.
Thank you. I'll recognize myself, and although Mr. Garvey, you are a Ph.D., is that right?
I wish I were, no, but I'm a lawyer. So I have a J.D., but not a Ph.D.
Oh, my
you don't
goodness.
have to write a dissertation.
My goodness, and we were telling people to treat you well here. Let me go through this very quickly. And I know you've heard, I mean no disrespect on the first panel, so I'll preface with that same thing. Jesus didn't practice here in the U.S. He practiced in the Holy Lands. And Mother Teresa, although she visited, she didn't practice here in the United States. But as I understand correctly, as to each of your institutions, if Jesus came with his disciples to the U.S. and paid any stipend whatsoever to his otherwise volunteers, because he administered to people who were, I guess, not Jewish, and there was no Christianity per se, and he didn't require that they embrace his view of everything in order to be healed or to be in any way ministered to, he wouldn't qualify. He wouldn't qualify for this exemption, would he? Or more importantly, Mother Teresa, as she dealt with lepers, she wouldn't be qualified under this rule for an exemption because it certainly wasn't a church activity, even though it was compassion at its highest level. So let me reverse the question now that I've gone into ground perhaps beyond my training. If I understand correctly, each of the institutions you attend, if you fire everyone who's not of your faith and dismiss every student not of your faith, you'd qualify for the exemption, wouldn't you? If you cloister yourselves only in one faith, closing off the opportunity to provide for all, you'd qualify, wouldn't you?
No,
Garvey?
I'm really sorry to say, but the exemption's even narrower than that.
Oh, so basically, even if it is only your faith, if you're only teaching your faith, even if you're only working with people of your faith, and even if you're only having attendance people of your faith, this exemption is narrower than that?
That's right. It's narrower than that. There are two additional provisions. One is that our purpose has to be catechizing or inculcating precepts of our faith, and we do things beside that at our universities. The final and more important one is that we have to be one of those institutions, few in number, that are exempt under tax law from filing a Form 990, and that only applies to churches and synagogues, mosques, and religious orders.
So I just want to understand, and the ranking member, I hope, wants to understand, so it's only the narrow definition of a church or a mosque or a temple defined specifically as a place of worship that's exempt. Otherwise, it's not exempt.
Religious orders, priests and nuns in
the convent would qualify.
Form and their integrated auxiliaries. It's fairly narrow. You have the right idea.
So, I was raised in two separate faiths. My parents agreed that we would suffer twice, and it served me well. But my father was an Orthodox Christian, and my mother a Mormon. So, on Saturdays we would go to the teachings of the faith. For Mormons, that wouldn't qualify because that wasn't actually a church service, but they were teaching us. At what point do we cross out of it? I just want to understand. Have they limited the definition of religion to be only inside the sanctuary of the church itself? Is that essentially what we have?
That may be the larger and more important point. As Bishop Laurie was saying in this morning's first panel, one of the unfortunate things about the narrow definition of religion is that it seems to confine religion to something that happens in church when you're on your knees, and to ignore what all of our Christian and other religious institutions think are important. But let me just stick with Christian institutions. The living out of the Beatitudes, to feed the hungry, to give drink to the thirsty, to clothe the naked, to visit the sick, those are things that are not considered religious activities, but they're the reason that most of our health care and social service organizations exist. And then to teach and spread the gospel to all nations is what our universities do.
Well, now, you came here as experts, both physician and experts in the field, and that's why we invited you here. But let me just ask one sort of conjecture or ask you to stretch a little bit. Ministers, priests, rabbis, clerics serve in our U.S. military for purposes of religious outreach. If I understand correctly, we're sort of saying, well, because it's not, their activity would not be limited to just inside a church, but rather they counsel, they advise, they bring people solace. In fact, they go to the hospital and visit people as they're dealing with the wounds of war. This definition is designed to be sort of, that doesn't count. That's not religion in this definition, not related specifically to the medical procedures that our minority has talked about so endlessly. Isn't this definition one that would begin to erode the very fundamental question of what is religious activity in America and what is religious freedom?
There's no question of that. The federal government obviously has a great deal of experience in writing exemptions for religious activity. Unfortunately, this is the very narrowest definition that we've seen, and all of our organizations wrote to Health and Human Services when these regulations were proposed, letting them know either individually or through organizations with which we were affiliated about our grave concerns over this exceedingly narrow definition.
Thank you. Mr. Cummings, I might hope that you could get some women onto your panel here to ask questions now that we have women they were asking for on the first panel.
Dr. Garrett, let me ask you, what did that, you said you all wrote, what did you say? In other words, you want women, you heard Ms. Gilaro talk about her health issue, a 25-year survivor of cancer. What did you all say with regard to trying to strike a balance that satisfies you?
We, through an organization, the Council for Christian Colleges and Universities, with which Oklahoma Christian is affiliated, wrote both to Health and Human Services and then to the White House regarding our concerns about the exceedingly narrow definition and also about the fact that these proposed regulations cover not only contraceptives but also abortion-inducing drugs. And, of course, we wrote about our grave concerns over that.
And if someone wanted to have needed contraceptives, how do you deal with that then? I mean, if they wanted insurance with contraceptives in it, in other words, the contraceptives are covered.
Well, at our institution, we offer contraceptive coverage.
Right. And so you have no problem with that?
Not with contraceptives. Our issue with respect to what is covered is with the abortion-inducing drugs like Plan B and Ella.
Dr. Theofelder, you said like you want to say something. Did you? You were squirming a little bit. Well, I understand that. Well, I'm trying to understand exactly what the concern here is with the administration's policy. I understand that you do not want to pay for a service that you have moral objections to, but you're not being asked to pay for them. Studies show time and time again that expanding access to contraception is either cost neutral or saves money. According to the National Business Group on Health, a nonprofit organization representing large employers on health policy issues, the cost of adding contraceptive coverage to a health plan is more than made up for in the expected cost savings. Likewise, when the federal government added prescription contraceptives to the Federal Employees Health Benefits Program, it found that this caused no increase in the government's premium costs. Actuaries that have studied this issue have concluded that providing contraception is cost neutral. Additionally, the administration's accommodation allows employees to go directly to the outside insurance company and avoid any interaction with the religious school or hospital itself. Under the accommodation, none of the institutions you represent would be required to provide coverage precisely because of the administration's respect for your religious beliefs. Why is the accommodation not acceptable?
Because I don't see it as being any different than the original mandate. In other words, we still have a contract with a health care plan, a health insurer. The plan we have right now is that we can carve those out and say we don't provide those services. However, with this new plan, we would be forced to have an insurance provider that we would have to provide those services to our employees. You're saying we don't have to pay for it, but somebody's going to pay for it, and being that it's our insurance plan and our provider, we would be forced to pay them our premiums. They are going to then supposedly for free provide these services to our employees, and that I don't see the difference between the two. In both cases, our insurance provider would be covering it, whether the mandate was the original one or we have this new exemption.
And if you did not see it in the premium, you still would feel that you're paying for it? Is that
Yes.
it? Dr. Oliver?
I would say additionally, Representative Cummings, that many of us, like my institution, have self-funded plans. So we are the direct provider in that case. There is no insurance company that can absorb that cost. It's directly paid by us. And as I mentioned in my testimony, we provide preventative health services for women, including contraceptives. We are opposed to abortifacients, including Plan B and Ella, which are required by this mandate. And I would further say, in regard to the accommodation, with all due respect to the administration, they said that there was an accommodation, but the rule is exactly as it was published on August 1st, 2011. Nothing has changed. There's just a promise that something will change in the future.
I'd like to add one other wrinkle to this, and that is that for all of these employers, they will be required to be involved in some manner because they must provide a list of who is covered as well as the applicable dates of coverage to the insurance company. So the involvement of the employers in assuring that women have access to the contraceptive and abortifacient coverage is inescapable.
Dr. Champion?
I understand that when...
Is your mic on?
When you're asking if we are no longer required to pay for it if it takes it out of our clear conscience, and because I am specifically charged with the duty of designing and signing my name to the student health care plan at Calvin College, when you force me, when the mandate forces me to add in Ella and Plan B as part of our package, especially as a preventative package, which would be 100% coverage, so we are responsible for managing that cost. That my signature is completely in discord with my belief system. So even if the insurance company can promise that they're not going to increase our premium by adding this expensive medication to the plan, you're still asking me to breach my religious liberty.
Thank you very much.
I thank the ranking member, and I recognize myself for 5 minutes. Dr. Thierfelder, thank you for being here today. I certainly appreciate your leadership of my favorite institution, my alma mater, Belmont Abbey, and appreciate your leadership in these tough times for the institution and what you've taken the institution through, as well as the monks and Abbot Placid as well. So just a few basic questions, just so we have this on the record. You are affiliated with a Benedictine institution.
A Benedictine monastery, Belmont Abbey, yes.
Okay. And as such, who is the decision maker about the tenets of the faith?
Well, the Abbot Placid as chancellor ensures that we are solid in terms of our mission. If you look at our articles of incorporation, the actual members of Belmont Abbey College Incorporated are the professed monks of Belmont Abbey.
Okay. So truly, when you describe the campus with the monastery at the heart of it, that is the incorporated nature of it as well.
Absolutely. It's central to who we are. In other words, the college is their apostolate. They came here, they're living out their vocation through this apostolate called Belmont Abbey College.
Okay. And since your founding, you've educated and helped and assisted non-Catholics.
I haven't been here the whole time, but yes, I mean, that is what the monks have always done extraordinarily well. They've always reached out. We're in Gaston County, and for those that don't know Gaston County, North Carolina, there's a high rate of unemployment. There's a great deal of illiteracy and so forth. We provide, I think, a invaluable service to our community, and our adult degree program is 70% women. And if you looked at our total enrollment of the College of Belmont Abbey College, you may think because we're a Catholic college, we must be all Catholics there. Maybe about 40% of all of our students are Catholic if you include the adult degree program.
But you are a Catholic institution.
Absolutely, and that's the whole point, and that's why this was so devastating to us, because our mission is to reach out, and as I said in my remarks, we welcome everybody as Christ. It's like, come on in, we love you. And so for us then to have to turn around and say somehow we can't welcome you in or you can't be part of our community is just averse to who we are.
So in essence, you're there as a result of the monks and the mission of the monks.
This was a call. I was not in higher education. I was in the private sector. I was in business. I was in sports medicine and sports law and sports medicine and so forth. I came here, and so did my wife and my family, because we really believed we were called to be at this college, and that's why we are here, because of that commitment. And I came because there was a Benedictine monastery that had a college.
Okay. So basically, what happens if this rule is put through? You're faced with a choice of either paying a $2,000 fine per employee.
Well, roughly right now for us, the cost of this would maybe be about $300,000 a year that we would have to pay.
Okay. And so you would either have to pay the fine or act counter to your faith.
Which we can't do. I mean, we just will not violate our religious beliefs. So we will have to find a way, depending on what happens, to get through this, but one of them will not be in any way sacrificing our moral convictions.
So pay the $300,000 fine or simply close down the college?
Well, you hope it would never come to that extreme. My hope is that there'd be intermediate steps. The unfortunate part would be if it came down to somehow limiting health insurance coverage or not being able to provide it in the same kind of way. I mean, that would be a terrible thing to do. I hope we would never come to that. I'm confident that we won't come to that, because I think hearings like this are made to maybe make these things better known and have a discussion. And obviously, may not be a lot of discussion in here today, but I'm sure people will be following this as I followed it. And my hope is that people will see the truth in this and realize that we need to do something about this.
Okay, so just for the record, how political are the monks on campus, and how political has Belmont Abbey been in its 130-year tradition?
Not political at all. I mean, if you know Benedictine monks, they're very quiet, humble men, who live and pray together. That is not what their interest and their life is not about politics. So
you've just been called to action based on the actions of this administration and with the EEOC and now with the HHS mandate.
I mean, this is really, as I said, I respect what the ranking member, Congressman Cummings, had said. This shouldn't be adversarial. We're not trying to get anybody. We're not trying to enforce our beliefs on anybody. However, our beliefs are really important to us. And so all we're asking is that we're not coerced into violating our religious liberty.
Okay. Thank you, Dr. Thierfelder. Dr. Champion, you're the only medical doctor on this panel. So the President said if you like the health care plan you have, you can keep it. What do you say to that?
Are you referring to the video we saw in the earlier panel?
Yes.
Right. If I was sitting in that audience, I would have been applauding the President for his vision. But when we mandate our Christian colleges and institutions to include abortive-causing drugs into their plan, and they have to answer to a higher calling and choose to no longer carry that student health plan, then inevitably we're limiting health care to students by closing down those very campus-wide health services that were previously providing excellent care to their students. And now the student no longer can pick her favorite doctor, which goes against both promises he made on that video.
Okay. Thank you. My time has expired. Mr. Amash is recognized for 5 minutes.
Thank you, Mr. Chairman. I'd like to thank all the witnesses for testifying today, but I'd especially like to welcome Dr. Champion, who's here from Grand Rapids, Michigan, in my district, and from Calvin College, which is my wife's alma mater.
I'm married well.
Most of my friends went to Calvin College as well. So, Dr. Champion, can you give us an example of how you personally make decisions about the student health care plans at Calvin College and how the mandate will affect your current plan?
Yes. So when I came to Calvin College this summer, I analyzed the student plan that was there. I learned that we charge $15 for every visit. We have phenomenal state-of-the-art physicians doing evidence-based care, yet Calvin chooses to subsidize their care by limiting the cost, even though we have a student plan that we do bill at 100% when they come in for preventative care. This is because we really emphasize the value of being able to instill and educate and train. When I analyzed the current plan, it showed that if she needed to come in for instance, a sexually transmitted disease evaluation, we had to charge her $10 for a gyne exam, $5 for a wet mount, and pretty soon the conversation for an underinsured student who didn't choose our plan would end up needing to be taken about the money relationship to the cost of care. So I redirected that fee in the next design plan to incorporate all of that in and redirect the visit toward the clinician's experienced guided evidence and not a discussion about cost. So by changing the plan in those very specific ways, I'm able to be a good steward of the limited plan we can offer them. When I learned that we have to add abortive agents and expand the coverage to include surgical sterilization, I'm aware that it substantially raises the premium because it does raise the risk, even if a 20 or 21-year-old student never requests a tubal ligation or vasectomy, because we have to add it into our plan. So there are financial reasons and for me to be a good steward of the plan, but more importantly, there are severe contradictions to my personal religious beliefs by adding Ella and Plan B into the plan.
And you're the only medical doctor on the panel, so could you elaborate on why you're opposed to having birth control and abortifacients listed as preventative services?
Right. Well, thank you for asking that, because this is really important to me. Preventative care defined by physicians has to do with anticipating future care by analyzing their past history. So you're asked your social history, your medical history, what age you are. We use your age to determine what your risk is. So a 50-year-old's risk for heart disease or colon cancer will help them determine which preventative care screening they need. When it comes to pregnancy, since it's not a disease, we are now treating a concern for the patient, which we actually move into a visit called diagnostic care. So the diagnosis is contraception counseling. We often will do it at her physical as a courtesy to her because she's so healthy, we don't want to make her come back, but it is actually not a preventative care service. Outside of that, Plan B and Ella are not preventative at all because they are actually a result of behavior where she is purposefully taking the medication to limit her risk for sustaining a pregnancy that may have started a day or 5 before taking the pill. Furthermore, when you talk about preventative care in a young woman, the U.S. federal government did give us new recommendations in December 2010. They did it under the CDC. And they asked physicians to step outside of whatever their Christian or other values are and to start speaking to patients about preventative care when it comes to STDs. And they've required or strongly recommended physicians to now ask patients to limit the number of lifetime partners and delay the onset of intimacy. Those guidelines from the federal government are well within preventative care measures, and I'm happy to abide by them because they do follow my principles, but they're also scientifically based and show that you can minimize STDs by giving this recommendation preventatively.
Does the President's so-called compromise make the mandate any less restrictive on your ability to freely exercise your religious and conscientious beliefs?
When the President spoke on Friday, I had a glimmer of hope that there was going to be an accommodation that perhaps broadened his definition. But he really doesn't have the right to decide the definition of when it is against my conscience. But what turned out to be in the written statement was no different than what he had presented us on August 1st of last year.
Thanks so much.
Thank you. With that, I yield to Mr. Murphy. 5 minutes.
Thank you, Mr. Chairman. Mr. Chairman, I know that the chairman of the full committee is not here right now to answer this question, but I appreciate the witnesses' patience today. It's been a long day for both the committee, the staff, and the witnesses. But we've been going round and round on this question of what the scope of this hearing is today, and whether or not it's appropriate to have women who have been affected by their inability to get birth control, have been affected by their inability to get a full range of reproductive rights, to have their voices here today. And I think the minority Democrats on this committee have tried every means possible to try to get that voice represented here today. And obviously, we were astonished to find not a single female on the first panel. And so, Mr. Chairman, I know you're not ultimately making the decisions that you're sitting in right now for Mr. Issa, but there might be another way around this. If we're having a hearing today that effectively limits the ability of women to present their case on why they deserve to have access to the full range of reproductive health care, if we can't have somebody like Sandra Fluke testify today about her medical condition and why access to contraception is so critical to her health, if we are now approaching the last minutes of this hearing without the ability to hear the other side of this debate. There are two sides. I admit that there's a very important question about religious freedom, but there is also a very important question about women's health care. And we've been told repeatedly today by Chairman Issa and others that this is not the time, this is not the day to debate that second question of the appropriateness of the rule granting women access to contraception no matter where they work. Maybe there's one last way out of this, which is to schedule a second hearing, to have a second hearing that would allow us to focus on the question of whether or not we are jeopardizing women's health care by not having a strong rule in place to give them access to preventative health care services and reproductive health care services regardless of where they work. And so I'll pose the question to you, Mr. Chairman. Do you think that the majority would entertain the notion of convening a second hearing? I understand we probably might not even get a witness at that hearing. Maybe we'd get one, maybe we'd get two witnesses. But do you think that the majority would entertain the idea of convening a second hearing to focus on this question of the appropriate level of coverage?
Will the gentleman yield?
Will
the gentleman yield?
Certainly would yield.
I'd be happy to engage in this. But the title of today's hearing is Lines Crossed, Separation of Church and State. Has the Obama administration trampled on freedom of religion and freedom of conscience, ? That was the question posed today about this hearing, not a question about your access or anyone's access to contraceptions. That is a completely different subject. When the chairman, I'm sure the chairman would be happy to have the conversation with you about future hearings and getting your input on that, but I don't think there's any movement afoot in Congress to ban contraception. That's not what this is about. It's about forcing religious institutions with deeply held moral convictions to do something that is counter to their faith. And with that, since I've taken so much time, I'd ask unanimous consent for 30 additional seconds for the gentleman.
Without objection.
Thank you very much, Mr. McHenry. I think once you've waded into this debate and selectively chosen to only talk about one side of it, which is the ability of a religion to decide whether or not they provide a basic range of health care benefits to their employees at a Catholic hospital or at a religious school, I think you have to talk about the second piece of the debate. I don't think you can choose as a committee. I don't think we should choose to only discuss one side of the debate. We thought that conversation should have happened today. We thought that at least one witness should have told the perspective of a woman struggling to get access to reproductive health care. But having failed in that effort, I think that we should have a second hearing. I know that we will have the deck stacked against us again, and I appreciate the gentleman for offering the fact that a discussion could certainly take place in the future. I think it would be incredibly important to this debate and to this committee to hear from women to hear from women that are struggling with this problem on a daily basis. And if that can't happen today, then, Mr. Chairman, I would submit it should happen in a hearing in the very in the future, hopefully within the next several weeks. Thank you, Mr. Chairman.
Mr. Chairman. Mr. Chairman, point of clarification. There are two individuals that are female on the panel here now, and I just want to make sure the record reflects such.
I think, Mr. McHenry, that's duly noted, but we have had 9 witnesses. 2 of the 9 have been female. I don't think that accurately represents the debate that is happening in the public when you're talking about an issue relevant to women's health care. To have 2 of 9 witnesses be females, I think is offensive to the dialogue that's happening in the public, and I think that we can remedy that if we come back and do this a second time on the issue specific to the health care concerns of the millions of women, the 99% of women in this country who have used or do use contraception.
With that, the gentleman's time has expired. I would be remiss if I didn't recognize, as I recognize myself for the next 5 minutes of questioning time, to be able to comment on that as well, Mr. Murphy. The topic today is on religious freedom. The issue that came up with this, that the President stepped into the middle of, was an issue of religious faith. This is not an issue of limiting, though I'm quite aware that the media and that my friends on the Democrat side of the aisle are trying to make this into an issue to make conservatives look like they are barbarians at the gate trying to take away women's reproductive health. That is not the issue. As has been widely accepted, there are contraceptives available for free all over the country in many locations. Contraceptives are covered in most of the health plans in America. The confusing thing to the administration and to some individuals, and not saying Mr. Murphy is this way, is that people that have deep religious faith, their faith extends beyond the walls of the church. And to define, you can have your religion as long as it is within the church building, completely violates the principle of James 1:27, that true religion is this, that we watch out for the orphans and widows in their distress, and that we keep ourselves from being polluted by the world. That is a basic tenet of Christian faith. Let me finish, and I'll try to yield just in time. To be able to say, you can practice your faith in this building and we'll honor it here, but if you extend out to taking care of the orphans and the widows in their distress, we're going to reach in as a government and define for you how you practice your religion. As I mentioned earlier in my earlier comments, the essence of this is, can this administration or any future administration step into a church or church-based institution and say, I know your doctrine, I have a different doctrine, you will give in to my doctrine or I will fine you. That is what occurred. Now, I understand the topic deals with something very controversial, but the essence of this conversation is, can the federal government step into a religious institution and redefine their doctrine for them? The real issue is, who defines the doctrine and religious teachings and religious practice of the church? I'd ask for unanimous consent for 30 seconds to give you an opportunity, then I need to finish some of my questions.
Thank you very much, Mr. Chairman. Just to your first point, which is that contraception is widely available, and thus we don't need to have that perspective here, and that we don't need to have a second hearing. Well, I don't think that a bunch of guys, a bunch of men on this committee should be making the decision as to whether contraception is available. And frankly, if you had allowed for Sandra Fluke to testify here today, she would have told you that it was not available to her, that it came at considerable financial burden to purchase it on her own. And so, again, I think we're getting to the root of this problem, is that to have a woman's perspective, have a healthcare consumer's perspective would be a lot more useful than for a bunch of males.
With that, I'd reclaim my time. And let me just mention this one thing to you as well on that. It's been interesting to hear the conversation about there should have been more women on the panel than the folks that mostly said that are now gone when women are on the panel. And there were conversations, there should have been some physicians on the panel. Now, if there is a physician on the panel, most of the folks that raised that issue are now gone and not participating in that conversation. So I understand that. The issue gets to the core still, can the federal government reach into a church or religious institution and define for them their doctrine? There is nothing in currently how this is being practiced from not continuing to press forward. Let me give you a good example of that. the Secretary shall make these decisions opens it up that within a year or two to say, currently, we're forcing all these different providers to provide abortifacients, contraceptives, and sterilizations for free. Under the guise of full range of reproductive rights, there's nothing to stop the Secretary from stepping in 2 years from now and saying, now all institutions will cover abortions, the procedure, for free. There is nothing in this that restrains that, because it's not the Federal Government paying for it. And so you'd say, well, wait a minute. No, this is stepping in saying those insurance companies will provide it for free. And so we'll step in between the contract between a religious institution and the insurance company that they've contracted with and say, we'll redefine the contract for you because I know you're religious and you don't know enough to know this is right, but we're going to tell you this is the right thing to do, and here is your new faith. Your new faith is you cover these things because it's the right thing to do. Your new faith will be that you'll cover abortions in some future day because that's the right thing to do to give the full range of reproductive health. And you could say that's some strange conspiracy, but quite frankly, we just watched the Catholic bishops lose a contract for taking care of human trafficking after they had tremendously high scores for one reason: they would not encourage abortions. Nothing covered abortions for them. They would not say to the people they were taking care of, there is a place to go get an abortion. And because they wouldn't do that, they lost the contract. This is a religious issue. And it is one of these things that I understand when you're with your own party, you look at that administration and want to help protect them and deflect the issues. Long term, this has serious consequences regardless of who is the president at some future day. What is the role of the church in that? With that, I'd be very honored to thank you for coming and sharing of your own time and your own background, submitting your statements and doing that. My time has expired. Let me honor Mr. Davis with 5 minutes.
Thank you very much, Mr. Chairman, and I also want to thank the witnesses for being here and being a part of this discussion. Since Ms. Fluke was not given the opportunity to testify, I'm going to read what her testimony would have been. She is a third-year student at Georgetown Law School that we requested. And here's what she would have said had she been here. A year ago, my friend from law school had to have her ovary surgically removed as a result of Georgetown's refusal to cover contraceptives. My friend chose Georgetown Law because of its commitment to public service, its location, and a generous scholarship the school had awarded her. She wasn't aware that Georgetown's student health insurance doesn't cover birth control, but she's gay, so it wasn't a big concern. During law school, my friend was diagnosed with the syndrome that causes painful cysts to grow on one's ovaries. The treatment for the syndrome is birth control, which can successfully hinder the growth of cysts. When she was first diagnosed, it seemed routine. The doctor wrote a prescription for birth control. Knowing of Georgetown's policy not to cover birth control for anything but medical conditions, the doctor wrote for non-contraceptive purposes on the prescription, and off my friend went to the pharmacy. But she was turned down because Georgetown's insurance carrier assumed my friend wanted the medication to prevent unwanted pregnancy. She worked with her doctor's office to navigate the university's process to get coverage, but no matter what she did, she was denied coverage of her much-needed medication. My friend's prescription birth control cost over $100 a month at her local pharmacy. She paid out of pocket for several months, but she was soon unable to afford the high cost of the medication. She had to stop taking it. In my friend's final year at Georgetown, she began having sharp pains in her abdomen. It was so painful, she woke up thinking she had been shot. When all the tests were completed, she learned that she had a plum-sized complex cyst growing on her ovary. The doctors had to remove her entire ovary because the cyst was just too complex. It had grown from the size of a plum to roughly that of a tennis ball. Had she been able to take birth control, the cyst would likely not have grown so rapidly or become so complex. Birth control could have made all the difference in preventing the loss of my friend's ovary. A year passed, but the complications from the removal of my friend's ovary are far from over. While we're here this morning, she is at a doctor's appointment set to determine if the removal of her ovary has thrust her body into early menopause. She's having weight gain, night sweats, hot flashes, and other symptoms of menopause, and my friend is only 32. If she is in early menopause, no fertility specialist in the world will be able to help her have children of her own. This is a heart-wrenching story, and I'm sorry that we could not hear directly from what this witness would have said. And I think this is part of the complexity of the issue, and I'd like to ask unanimous consent that the statement be entered into the record.
Without objection, so ordered.
And I yield back.
Gentleman yields back. I want to thank all our witnesses today. You've been very generous. All of you were here for the first panel and the second panel, and I appreciate your contribution to our better understanding of religious freedom, first from the clergy standpoint and now from the people so close to the administering of other services on behalf of religious organizations. Thank you. We stand adjourned.